Chris is a 10-year-old soccer player who has asthma and uses the ProAir HFA Quick Relief Inhaler. Susan is his mother. They're here to talk to you about asthma and exercise-induced bronchospasm, or EIB. They'll also show your child how to take care of the ProAir HFA inhaler and give you tips for dealing with asthma and EIB at school.
Chris was having a lot of breathing problems. He would wheeze, especially at night. He'd tell me his chest felt tight and he had trouble getting his breath.
Wheezing, coughing, chest tightness, and having trouble catching your breath are all possible symptoms of asthma.
I took Chris to see the doctor. He asked him about his symptoms and checked his lungs. Chris's doctor diagnosed him with asthma. He also asked if he had any other conditions or used any other medicines. Medicines for other conditions can sometimes interact with asthma medicines. When Chris has an asthma attack, the muscles around his airways get tight. That makes the airways constrict or get narrower, so it becomes harder for the air to enter the lungs. Chris's doctor prescribed a quick relief inhaler called ProAir HFA for his asthma attacks. ProAir HFA is a quick relief inhaler containing a medication called albuterol. It is approved for use in adults and children aged 4 and older to treat tightening and narrowing of the airways. This can occur with conditions like asthma or chronic obstructive pulmonary disease. It is also used to prevent exercise-induced bronchospasm, or EIB. The medicine in the ProAir HFA inhaler makes these muscles relax, letting his airways open up again. It usually takes 3 to 5 minutes for ProAir HFA to start working. Chris's doctor also wrote out an asthma action plan that tells us when he should take his medicine and what to do if we have an emergency. I'm glad his doctor and I took the time to go over the best way to manage Chris's asthma.
You should seek emergency treatment if your child has a serious asthma attack. Signs of a serious asthma attack can include severe wheezing or breathing problems, trouble speaking in complete sentences, straining to breathe. Visit www.proairhfa.com/PI for full prescribing information or call 1-888-482-5922 to have a copy sent to you. Approved uses. ProAir HFA albuterol sulfate inhalation aerosol is indicated in patients 4 years of age and older for the treatment or prevention of bronchospasm with reversible obstructive airway disease and for the prevention of exercise-induced bronchospasm. Important safety information. If your symptoms become significantly worse when you use ProAir HFA albuterol sulfate, contact your doctor immediately. This may indicate either a worsening of your asthma or a reaction to the medication, which may rarely occur with the first use of a new canister of ProAir HFA. Either of these could be life-threatening. What to tell your doctor before using ProAir HFA. If you have a heart, blood, or seizure disorder, high blood pressure, diabetes, or an overactive thyroid, be sure to tell your doctor. Also, make sure your doctor knows all the medications you're taking, especially heart medications and drugs that treat depression, because some medications may interfere with how well your asthma medications work. Do not exceed the recommended dose. Side effects associated with ProAir HFA included headache, rapid heartbeat, pain, dizziness, and irritation of the throat and nose. You're encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088 to report negative side effects.